When it comes to the question about how much time is typically spent in the rehab facility, I would argue there should be as little time as possible in a rehab facility. And as we've seen with outpatient joints, people can do more at home than I think we ever thought they could. And most patients would say that, in fact, when they do go home and they realize that, their whole perception changes about the process. And there's a lot of value to that. And so there is a population of patients that will have to go to rehab. I don't think it necessarily has to do with obesity and necessarily diabetes. The patients that stick out to me who go to a rehab facility are those who have multiple medical comorbidities that require sort of a multidisciplinary management approach. Patients with significant heart disease, kidney issues, certain patients who have a history of infection and may require advanced medications through an IV. The other scenario is really social support. So there's some patients who just don't have the support at home or live in a situation where they can't manage their care themselves. I think those are the patients that benefit from rehab. Right now, our goal is to really try to limit that number. And I can't give you a firm number, but about 10% of patients in our practice, and even less than that now, go to a rehab for a short period of time. And in terms of whether or not doing a staggered double knee replacement affects the time spent in rehab, I think that totally depends on the patient.